What is gag reflex? So everybody does this in the morning. That is when they wake up and use the washroom. That time they will spit like this. When they do, they clear their throat, right? So that is called gag. That is intentionally they are clearing the throat of the phlegm or the sputum. But it also occurs by reflex mechanism. Reflex is a unplanned, involuntary activity which occurs as a protective mechanism. So what is that protection? That protection is when the secretions are accumulated in the throat, that is in the pharynx especially, it can enter the larynx, trachea and lungs, causing infection in the lung. To prevent this, nature has provided gag reflex. Any reflex consists of 5 components, that is receptor, afferent, information from there reaches the brain or the brainstem, center, decision making area, efferent, that is the nerve coming from the brainstem and supplying the muscles over there, then effector organ, which is nothing but the muscle. So the gag reflex is mediated by the following. Number 1, the receptor for that any irritation, the receptors are present in the following area, that is the base of the tongue, the posterior 1/3 of tongue, tonsillar area, tonsillar bed, in the lateral wall of oropharynx and the entire pharyngeal mucosa. Any irritation of these areas, these receptors will give information to 9th cranial nerve. 9th cranial nerve, when you draw 9, it appears like G, glossopharyngeal nerve. This information from the glossopharyngeal nerve reaches the brainstem level, specifically speaking the medulla oblongata part, that is in the floor of the 4th ventricle. From there, the medulla oblongata is a center or decision making area. It will give information to the neighbor, that is the next cranial nerve nucleus, that is a vagus nerve. So vagus is the efferent nerve. From there, vagus nerve will come and control the muscles of the pharynx. When the muscles of the pharynx are the effector organ, that is the 5th point. These muscles, sudden contraction of these muscles help in this, help in clearing the throat. So gag reflex is a very protective reflex. It helps in the clearing of the throat. Otherwise, infection of the lung can occur. The receptor is present in the base of the tongue, tonsillar bed and the pharyngeal mucosa, that is a touch receptor. From there, glossopharyngeal nerve takes the information to the brainstem, specifically medulla oblongata. Vagus nerve is the efferent nerve. Then effector are muscles of the pharynx. So this is about in detail about gag reflex. We can touch the gag reflex by just taking one cotton and ask the patient to open the mouth and touch the posterior pharyngeal wall. When you touch the posterior pharyngeal wall, patient will be like this, he will do. This is normal. If it is damaged, that means damage is there in the